really need the confirmation of the biopsy.
Right.
And my advice is no, you don't need the confirmation of the biopsy unless you're the type of person that needs that very cut and dry, very black and white answer.
Right.
But even in that case, the biopsy oftentimes comes back falsely negative.
Right. And I think I saw, it might have been on your website, an article or something that talked about people that need multiple biopsies or up to 8 biopsies, or somebody had something that until they finally, and I think maybe it said that it was still negative after all those biopsies, or I mean it didn't just happen. You don't just get one biopsy and that's it, it's done. Sometimes it takes multiple.
Exactly. A biopsy is just a small fragment of the surface area of the small intestine. So doing a sample or doing several cuts or biopsy cuts is no more a representation of the entire intestine than a grain of sand is a representation of the entire beach.
I like that. And by the way, you have a lot of those good little, I'll call them one-liners for lack of a better thing, but you have a lot of those. Looking at your site today, you had one, and I'm going to get to this here in a minute, but about where you had put it, but the world was flat before it was round. And you have a lot of those, and I love them. I love those. I like all those little, I'll call them one-liners.
Well, I appreciate it. I'm a scientist at heart, so sometimes speaking in scientific terms is not what gets the point across more so than just speaking in terms that everybody can really relate to. And so I've kind of practiced that art over the last 10 years.
I like it. So if talking about the gluten sensitivity or celiac disease, do you, and the fact that you don't need it confirmed if you feel better and that kind of thing, but what do you currently recommend for testing for either condition, for any of those conditions? Is there something in particular, genetic over the blood test or the biopsy? I mean, do you recommend any of those things?
I kind of have a unique experience with this because I almost lost the life of one of my patients over blood tests. I had a young boy, he was terminal, he had juvenile rheumatoid arthritis. The Make-A-Wish Foundation granted him his wish. And it took me months to convince his mom to take him gluten-free after negative blood test results. And so, but he had positive genetics. And so it really altered the face of how I view and try to diagnose and help people with potential for gluten sensitivity. My advice and what I tend to do in my own clinic is if a patient presents with any autoimmune disease, regardless of the type of autoimmune disease, I genetically test them for gluten sensitivity. And we look at more than just the celiac genes. There are multiple genes that we look at. And so a lot of people are fixated on HLA-DQ2 and HLA-DQ8 as the diseases or as the genes associated with celiac disease. And although these are important genes to look at, they're not the only ones, and they're not the only markers. So we tend to look at the genes in the presence of symptoms. If somebody's completely asymptomatic, they eat gluten and they feel fine, we don't really tend to see patients like that. So usually when somebody comes to see me, it's because they have a problem. So we use the genetic markers to help diagnose more so than we would use the lab test. I've just had too many false negatives on labs. And the thing about patients, once they see that they're negative, it's very hard to convince them back the other way to even try the diet.
Right.
And so, even if they were to attempt, I guess you could say if they were to attempt to try the diet and they felt better, then they would have their kind of proverbial proof in the pudding because they felt better. But if they didn't try the diet because the test came back negative and the GI doc or whoever they were speaking with said don't worry about it, and now they're going to remain sick potentially for the rest of their lives.
Right. And the genetic test, a lot of people, they don't want to do the blood test. Nobody likes to get stuck and that kind of thing. As far as the genetic test, what kind of test, how do you get the sample for that?
We use a buccal swab. So they swab the insides of their cheeks and then they ship it to the lab, and generally our lab has a 7-day turnaround, so we can get the data back pretty quick.
And you can order those on your website, is that right?
Yeah, you can. We've actually arranged a deal with one of the very few places that does this type of testing. So I think the cost is, if you're just a normal person coming in off the street, is around $600, but we were able to arrange a deal where we could substantially save somebody money if they wanted to get tested. The cost is $320. I think the actual cost is like $650.
Nice, good, and it's and we'll link to that as well. Once we get the archive of today's show up, we will link to that too, so people can check that out. Sounds a lot easier than getting stuck, especially for kids and things.
Yeah, absolutely. Yeah, kids hate to get stuck.
Yeah.
If I can save them the blood, I will.
Let's see. So on your, now I'm going to get into a couple things that, and I think this one here that I'm going to talk about right now is where I saw the world was flat before it was round reference. But there was a few references. There's a lot of good videos on the site. There's a lot of the Fox News videos and things I like. And there's several references on the website, which is, by the way, towncenterwellness.com, that note that corn, rice, and other grains could potentially cause problems for those of us with celiac disease, or could at the very least cause similar reactions. Have you seen potential issues with these grains, or what can you tell me about the potential issues with the quote-unquote gluten-free grains?
Well, let's just clear this up then. There's no such thing as a gluten-free grain. And a lot of people are very confused about what gluten actually is. Gluten is actually a storage protein found in all grain, and grain is defined as the seed of grass. And most of the grasses that we refer to are what we call the monocot grasses, single-leafed grasses. So without getting too technical, there's no such thing as a gluten-free grain. So the whole it's a big misnomer. Now, what we know about celiac disease is that the main grains originally studied, I believe he was a German scientist, was that when he took wheat, barley, and rye out of the diets, or actually more so when those foods were absent from the diets of these children because of the war, he found that their gastric symptoms would dissipate. And so that kind of stuck. Now, some doctors went on later to identify a particle found within gluten, more specifically gliadin, or alpha-gliadin to be even more specific, is the protein that is, what we consider to be the inciting agent in celiac disease. But nobody's ever really thoroughly studied the other grains. There have been about a dozen studies now on corn and corn gluten and how it can create additional inflammatory response, especially in those with celiac disease. What people don't know is whether or not it's the corn itself, or whether it's kind of the celiac predisposition that doesn't allow them to tolerate the corn. This just hasn't been studied well enough.